In this video, we will discuss 25 numbers of important MCQs which are most important for exam point of view. The question is, the study of biochemical side and physiological effect of drugs and their mechanisms of action are known as, options are pharmacoeconomics, pharmacogenetics, pharmacoepidemiology, pharmacodynamics. Answer is D, pharmacodynamics. Where is drugs come? This is called pharmacodynamics, drugs and their mechanisms. Next question, repeated administration of drug result in cell receptor blockage is known as tachyphylaxis, tolerance, idiosyncrasy, synergism. Answer is A, tachyphylaxis. Repeated administration of drug results in cell receptor blockage. This is known as tachyphylaxis. Next question, a drug that reduces the activity of another drug is called, most important question and repeated question, options are agonist, synergist, adverse reaction, antagonist. Answer is D, antagonist. The drug that reduces the activity of another drug is called antagonist. Next question, which of the following is an additive drug combination? Which of the following is an additive drug combination? Options are amlodipine atenolol, histamine adenylene, sulfamethoxazole, trimethoprim, tyramine MAO inhibitors. Answer is A, amlodipine and atenolol. Amlodipine is a calcium channel blocker and atenolol is a beta blocker. Next question, physiological antagonism occurs between, options are adrenaline and histamine, acetylcholine and atropine, both A and B, none of these. Physiological antagonism occurs between, answer is A, adrenaline and histamine. Next question, efficacy of a drug refers to, options are affinity of drug to bind to receptors, affinity of drug that binds to receptors and activates it, dose that requires to produce response, maximum response a drug can produce. Answer is D, maximum response a drug can produce. Efficacy of a drug refers to maximum response a drug can produce. Next question, which of the following is a physiological antagonist? Options are adrenaline, methacholine, nicotine, pilocarpine. Answer is A, adrenaline is a physiological antagonist. Next question, which of the following drugs does not act through G protein coupled receptor? Options are epinephrine, insulin, dopamine, TSH. Answer is B, insulin. Insulin is not act through G protein coupled receptor. Next question, the discipline which deals with the effect of the drug on the body is, options are pharmaceutics, pharmacokinetics, pharmacodynamics, toxicokinetic. Answer is C, pharmacodynamics. As earlier discussed, effect of the drug on the body is pharmacodynamics. Next question, which of the following is the second of messenger of the G protein coupled receptor? Options are CAMP, phospholipase C, adenylyl cyclase, sodium ions. Answer is A, CAMP. CAMP means cyclic adenosine monophosphate. Next question, the action of drug on the body, phenomena and mechanism of including receptor interactions, dose receptors, therapeutic and toxic action defined as, options are toxicology, pharmacokinetics, pharmacogenetics, pharmacodynamics. Answer is D, pharmacodynamics. The action of drug on the body, phenomena and mechanism of including receptor interactions, dose receptors, therapeutic and toxic action defined as pharmacodynamics. Answer is here first question, the action of drug on the body is pharmacodynamics. Next question, side effect of a drug can be minimized by its high affinity, solubility, hydrophobicity, specificity. Answer is D, specificity. Side effects of a drug can be minimized by its high specificity. Next question, which of the following does not act as second messenger? Options are cyclic AMP, diacyl glycerol, G proteins, ionocetal, triophosphate. Answer is C, G proteins. G proteins not act as second messenger. Next question, affinity is a measure of, options are drugs binding to plasma proteins, drugs binding to a receptor, inhibiting potency of drug, bioavailability of a drug. Answer is B, drugs binding to a receptor. Affinity is a measure of drugs binding to a receptor. Next question, foreign bodies which are present in our body are collectively called as, options are genobiotics, probiotics, antibiotics, heptane. Answer is A, genobiotics. Foreign bodies which are present in our body are collectively called as genobiotics. Next question, when certain drugs administered repeatedly at short intervals, decreased response is often is called idiosyncrasy, tolerance, tachyphylaxis, antagonism. Answer is C, tachyphylaxis. When certain drugs administered repeatedly at short intervals, decreased response is often is called tachyphylaxis. Next question, regarding termination of drug action, options are drug must be exerted from the body to terminate their action, metabolism of drugs always increases their terminate water solubility, metabolism of drugs always abolishes their pharmacological activity, hepatic metabolism and renal excretion are the two important mechanisms involved. Question is regarding termination of drug action. The answer is D, hepatic metabolism and renal excretion are the two important mechanisms involved. Next question, which of the following is a false statement for competitive antagonist? Options are they have an affinity for the agonist, binding site on receptor, they have no intrinsic activity, they cause parallel rightward shift of the control dose response curve, maximum response of the agonist cannot be achieved in their presence by increasing the concentration of the agonist. Answer is D, maximum response of the agonist cannot be achieved in their presence by increasing the concentration of the agonist. Next question, teratogenicity refers to, options are ability to cause defects in the eyes, ability to cause defects in the ears, ability to cause defects in the bones, ability to cause defects in the fetus. Teratogenicity, answer is ability to cause defects in the fetus. Next question, rapid development of tolerance on repeated doses of a drug in quick succession with reduction in clinical response is termed as synergism, antagonism, idiosyncrasy, tachyphylaxis. Answer is D, tachyphylaxis. Next question, chemical intoxications occurring over 24 hours or less than that result in toxicity. Options are subacute, chronic, acute, subchronic. Question is chemical intoxications occurring over 24 hours or less than that results in toxicity. Answer is C, acute. Next question, in ADR unusual and unexpected drug effects are known as, options are excessive pharmacological effects, secondary pharmacological effects, idiosyncrasy, allergic drug reactions. Answer is D, allergic drug reaction. In ADR, unusual and unexpected drug effects are known as allergic drug reaction. Next question, substances used to counteract the effects of poisoning are, options are antitussives, antidotes, anti-inflammatory, anesthetics. Answer is B, antidotes. Antidotes is a substance used to counteract the effects of poisoning. Next question, which of the following drug used to treat cyanide poisoning? Options are quinidine, amyl nitrate, nicorandil, nifedipine. Answer is B, amyl nitrate, drug used to treat cyanide poisoning. Next question, it is the usual drug reaction that cannot be explained by the inherent properties of the drug themselves, but instead by some altered characteristics in the patient taking the drug, that is called as drug dependence, therapeutic index, idiosyncrasy, teratogenicity. Answer is C, idiosyncrasy. These 25 questions are most important for exam point of view and most important for railway pharmacist examination. Thank you.